Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we will be talking about summer food safety. And we have Mary Lou Stone here from Environmental Health Services in the Frederick County Health Department to give us some helpful and healthy tips. Mary Lou, welcome. Thank you for joining us.
Thanks for having me.
Well, what is special about summer when it comes to food safety?
Summertime is the time when a lot of families are getting together, either on the beach or for graduation or for parties in the backyard or just summer picnics.
Well, what are some of the risk factors that are special about summertime?
It could be things from when you purchase the food, how you handle it, how you store it, temperature abuse, and cross-contamination.
So you mentioned temperature abuse. Can you tell us what that is?
One of the biggest things is when you first go and purchase your food, you want to make sure that you don't put it in a hot car and then drive around all day with your food in the hot car. You want to make sure that when you're cooking your food, you're actually cooking it to the right temperature and not just getting it halfway done. You want to make sure when you're thawing your food that you don't think, gee, in the morning, I'm going to put a roast out and cook it that night. It needs to be thawed in the refrigerator and not out on the counter.
I think you've mentioned a danger zone. So
Yes.
what are those temperatures in the danger zone?
There is a danger zone. We like food either below 40 degrees or above 140 degrees. So the danger zone would be where bacteria can grow when food is between 40 and 140 degrees.
Okay. Let's see, cross-contamination, you also mentioned that.
That's one of my favorites. Cross-contamination can happen a lot, especially when we're having that party out back and we're grilling our steaks. And we put it on a plate to take it out, and you take it out to the grill, and you get it exactly to the right temperature, and then you put it back on the plate that the steaks, when they were raw, comes back on. So we've now just cross-contaminated. It can be things like when you're actually using cutting boards in the house. You're cutting the steak when it's raw into these wonderful portion sizes, and you send it out on shish kebabs, and then you take the same cutting board and you end up cutting the melon. It can be things like you're trying to cut the watermelons, and in fact all melons have contaminants that are on the outside of the rinds. So you need to make sure you're cutting those, wiping them down before you cut them.
What else is there? So now you've covered the sort of the storing after you've purchased it, the cooking and what you should do. Anything else with handling?
Yeah, there's a couple things. One is grazing afterwards. You want to make sure that once you've cooked the food, you've got like about a 2-hour window before you get that refrigerated. And of course, the most important thing is hand washing. You want to make sure that you're hand washing before you handle food, before you handle utensils that people are eating, before you set the table. You want to make sure you're washing food, especially with family gatherings, after you've changed the baby's diaper, after you've petted the family dog. And it's not just putting a little bit of soap in the palm of your hand and going like that. You actually want to get it all over your hands and actually sing the happy birthday song because it's one of the best ways to prevent the foodborne illnesses.
And what is the most common foodborne illness these days?
Common one is norovirus, and especially in this area of the country where we love our seafood, especially our crabs. Norovirus is a virus that can cause stomach pains, it can cause diarrhea, fever. In fact, it's one of the most not popular, but one of the most common occurring viruses that we have for foodborne illness. And so it can cause a lot of things that you just don't want to happen with your family. So you want to make sure that you're washing your hands. You want to make sure that you're cooking the foods to the correct temperatures so we can kill that virus. And if you're sick, you definitely do not want to be the person fixing the food for the family picnic. You want someone else to fix the food.
And I can say from the infectious disease side of the health department that definitely we've seen outbreaks this year, a lot of outbreaks of norovirus, of the GI illnesses that likely are norovirus, and it's probably from that handling and cross-contamination that you talked about.
Yeah, and a lot of times people don't know they're really sick yet because norovirus has it's a 12 to 48-hour incubation period. So it's a hard one sometimes in the very beginning to realize that you might be one of the people that's infecting stuff and you don't realize it.
All right. Well, very good. Thank you for those helpful summer tips, and I hope that everybody remembers the danger zone. Do you want to remind everybody that temperature?
The danger zone again for food is between 40 and 140 degrees. So we want to keep food that's supposed to be cold, cold, and food that's supposed to be hot, hot, and not somewhere in between.
Great. Thank you very much. I hope people pay attention to your advice and keep themselves and their friends and family safe when they're eating out this summer.
Thanks.
And now please stay tuned for this month's Medical Myth.
Credit and debit cards are now accepted at the Frederick County Community Development Division. Customers can now pay for permits, inspections, and development review fees with their credit or debit card, either online, over the phone, or in person at the office. Please note that a service fee will be charged by the card processor for these transactions. We hope that this new convenience will further strengthen the Frederick Board of County Commissioners' business-friendly strategic goals as part of our Open for Business campaign. For more information, visit frederickcountymd.gov/community development or call 301-600-2313. The Frederick Board of County Commissioners invites you to watch live and archived broadcasts of county meetings. Simply visit the Frederick County Government website at www.frederickcountymd.gov and click on the link to watch FCG-TV live or the link for FCG-TV archives. You can also save time when viewing a previously broadcast meeting by locating the agenda topic of interest and clicking on that item. The broadcast will then start at that section. These website tools are designed for the convenience of our viewers and to improve access to county government open meetings. And did you know that you can watch FCG-TV on your mobile devices as well? For more information, visit www.frederickcountymd.gov/FCG-TV. The Frederick County Meals on Wheels program delivers nutritious meals to homebound seniors and others who can't shop or prepare foods on their own. Sometimes the only smiling face a senior may see during the day is that of a Meals on Wheels volunteer. With almost 100 on the waiting list, the program needs volunteers and individual donations, as well as corporate sponsorships to supplement government funding of the program. Please call the Department of Aging at 301-600-1605 or visit our website to find out how you can make a difference with your thoughtful support.
And now here's this month's Medical Myths. Welcome to this month's Medical Myths, where we'll be talking about skin cancer from the American Cancer Society and the Cancer Foundation. The first myth is that tanning at a salon is safer than tanning outdoors because it's a controlled dose of UV radiation. Well, the fact is, when compared to people who have never tanned indoors, indoor tanners have a higher risk of all forms of skin cancer. One report indicates that frequent tanners using high-pressure sun lamps may receive as much as 12 times the annual or year-long ultraviolet A dose they would otherwise receive from sun exposure. A second myth is that you can't get sun damage on a cloudy day. The fact is, just because you can't see your shadow doesn't mean you're safe from the sun's damaging rays. Believe it or not, up to 80% of the sun's UV rays can penetrate through clouds and fog. That includes winter days too. Another myth that's very popular this time of the year is that a base tan protects your skin from sunburn. The fact is, there is no such thing as a safe or protective tan. Any tan at all is a sign of skin damage. Skin tans in response to UV damage to the skin's DNA. A tan is the skin's attempt to repair sun damage and prevent further injury. But these imperfect repairs can cause gene defects that can lead to skin cancer. Another myth is that if you use sunscreen with an SPF of 50, you're all set. Well, the fact is, a sunscreen's SPF, or sun protection factor, indicates that it protects against UVB rays, but you need protection from both UVB and UVA. For effective protection, apply a broad spectrum, that means both UVA and UVB, sunscreen. Apply a generous amount of sunscreen, about a palmful, and reapply every 2 hours and after swimming, toweling, or sweating. Another myth is that people of color don't get skin cancer. People of color are less likely to develop skin cancer than Caucasians, but they have a higher risk of dying from it. A very dangerous and fast-spreading skin cancer known as acral lentiginous melanoma is more common among darker-skinned people and may appear as a suspicious growth in the mucous membranes, under the nails, or on the palms or soles of the feet. Whatever your skin color, protect yourself. In summary, there is no such thing as a safe tan. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. In recognition of February being American Heart Month, this month's tip is about the Million Hearts Initiative. Launched by the U.S. Department of Health and Human Services with several key partners, Million Hearts aims to prevent 1 million heart attacks and strokes over the next 5 years. Heart disease and stroke are two of the leading causes of death in the United States. Million Hearts brings together communities, health systems, nonprofit organizations, federal agencies, and private sector partners from across the country to fight heart disease and stroke. It is focused on two goals: empowering Americans to make healthy choices, such as preventing tobacco use and reducing sodium and trans fat consumption, and improving care for people who do need treatment by encouraging a targeted focus on ABCS, which stands for aspirin for people at risk, blood pressure control, cholesterol management, and smoking cessation. These address the major risk factors for cardiovascular disease and can help to prevent heart attacks and strokes. People of all ages, genders, races, and ethnicities are at risk for heart disease and stroke. However, certain groups, including African Americans, older individuals, and women, are at higher risk than others. The Million Hearts campaign outlines several things that you can do as an individual. Prevent heart disease and stroke in your family by understanding the risks. Get up and get active by exercising for 30 minutes on most days of the week. Know your personal ABCS, appropriate aspirin therapy, blood pressure control, cholesterol control, and smoking cessation. Stay strong by eating a heart-healthy diet that is high in fresh fruits and vegetables and low in sodium, saturated and trans fats, and cholesterol. Take control of your heart health by following your doctor's instructions for medications and treatment. In addition, you can take the American Heart Association's My Life Check. This online tool helps you to understand your current level of cardiovascular health, assess your individual health needs, and take steps to reach your personal health goals. With all of us working together, individuals, families, communities, health providers, and national public and private organizations and businesses, we can meet the goal of preventing 1 million heart attacks and strokes over the next 5 years. Take time today to choose one small thing that you will do to make it a reality. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.
Frederick County's GIS team has updated the popular at-a-glance online mapping tool that puts all kinds of information at your fingertips. A new menu as you enter the program provides a user-friendly guide to what's available with large, easy-to-read icons. Just enter your address, zoom to your property, and have useful data about schools, zoning, libraries, parks, and much more. With a click of your mouse, fast and convenient search functions allow you to get your recycling schedule, find out assessment and property taxes, and discover crime statistics. To access the program, simply go to the Frederick County Government website, frederickcountymd.gov/at-a-glance.